My literature review was focused on the findings of the effectiveness in treating urinary tract infections in females with probiotics. I looked at a number of different studies whilst I was preparing for my review. Then I narrowed it down to 5 that I found to be most relevant and recent to the topic. So a little about the topic before I discuss the findings and implications for future research. Urinary tract infections are bacterial infections of some part of the urinary system, and they are much more common in females than they are in males. This is due to the shorter length of the urethra in the females, meaning less distance for the bacteria to have to travel. Some symptoms of a urinary tract infection can include pain or burning whilst urinating, urgent and frequent urination, and low back pain. Lower back pain could indicate that the infection has spread to the kidneys and is more severe. Probiotics, which were reviewed as a treatment option for urinary tract infections, are microorganisms that can be introduced into the body to provide a health benefit to the host. Probiotics are commonly encouraged as alternatives for the prevention and treatment of infectious diseases. Lactobacillus' role in maintaining vaginal health was first recognised in the late 18th century by Dordelin. His idea of administering lactobacillus for the maintenance of a healthy vaginal microflora is over a century old. I looked at 5 scientific studies published between 2006 and 2013 and found that in conclusion, the hypotheses that probiotics are effective in the treatment of UTIs in females could not be proven. Out of the 5 studies, none had a significant enough result to prove that probiotics are effective in the treatment of urinary tract infections in females. The strongest study of the 5 that I reviewed was a study undertaken by Biraput. It proved to be the strongest due to the length, and the inclusion criteria. The study was focused on comparing the results of antibiotics and probiotics for the prevention of urinary tract infections in 252 postmenopausal women. The results of this study suggested that the probiotics did not meet the non-inferiority criteria in the prevention of urinary tract infections in postmenopausal women when compared with the antibiotics. The study demonstrated validity and reliability in the way it was conducted as a double-blind non-inferiority trial and the large number of subjects that were treated. The population and inclusion criteria were narrowed down, providing more efficiency in the results of the study. The next 2 studies that I analysed in the review did not prove to be as strong as the previous. They either involved fewer participants or the duration of the study was much shorter. Stapleton and Vujic both conducted studies that concluded that probiotics can be used as a safe alternative treatment for urinary tract infections in females. However, both of the studies did also suggest that larger trials are necessary for more conclusive results. Another study done by Uhira conducted a study of 9 women. All of the women had experienced 2 or more episodes of urinary tract infections in the prior 12 months. The results of this study demonstrated that vaginal suppositories with L. crispatus can reduce the recurrence of urinary tract infections without any complication during treatment. However, the results of this study do not prove to be of high validity as the inclusion criteria of the patients was very few. And the last study I looked at was a study done on 30 women aged between 18 and 35 years old over a period of 5 days. The conclusion of the results was that the probiotic was found to be handled well when given as a vaginal suppository to healthy females with a history of urinary tract infections. Strengths of this study included the placebo-controlled randomized study design and the extensive and complete follow-up. A weakness was the inability to accurately document vaginal colonization with the probiotic strain and the very short duration of the study. All of the studies were inconclusive and suggested probiotics as an alternative or co-treatment. From these inconclusive results, I think it is clear that further studies are needed to be done and must include more randomized placebo-controlled trials with larger patient trials and tighter inclusion and exclusion criteria. Thank you.